To end off the show, I'm joined by a very special guest. Dr. Sean Vasu, Clinical Director of the National Centre of Infectious Diseases, is here to tell us about how NCID has been dealing with the outbreak. Welcome, Dr. Vasu.
Thank you, Dylan.
Well, Dr. Vasu, so much to talk about. Now, let's get to it. Now, most of the 90 patients here are stable and recovering, but 7 are in critical condition. Could you describe the range of symptoms? What does a stable patient look like and compared to someone who's in the ICU?
Yeah, so with COVID-19, as you know, this is caused by a novel coronavirus, which now has been named SARS-CoV-2. The range of symptoms in this illness is quite varied. It ranges from, unlike SARS in 2003, it ranges from quite mild to more severe cases. It is a bit reassuring to know that most of the cases, 80% or so, have a relatively mild illness, and their symptoms are quite like the common cold, and the common symptoms include a cough. About 80% or so would have a fever, some would have a sore throat. From our experience, running nose is a bit less common than the other common cold viruses. And then a smaller percentage of patients have a more severe type of illness. About 20% have a more severe form of pneumonia. But that does not mean that all of them have to go to the intensive care unit or the ICU. About 5% of these patients need added care and they end up in the ICU. And the main reason why they end up in the ICU is because they have a severe form of pneumonia and they need some support for their lungs. So generally they need some support with mechanical ventilation or support for breathing. Yeah.
Now, doctor, I think a lot of people are very curious. Take us through the whole process. From being a suspected case to being a confirmed case. What tests do they undergo?
Right. So I think we need to understand what a suspect case is. So a suspect case combines both clinical and what we call epidemiologic criteria. The clinical criteria, of course, being a suspect case, you must have symptoms of the disease. For example, respiratory type illness or symptoms of pneumonia. And then you must have some, what we call an criteria, epidemiologic link. And that usually, in the earlier days of the outbreak, that included travel to China or to hotspots. And then now we consider a significant epidemiologic link as one who, if you had contact with someone who has a diagnosis of COVID-19, that would put you in a suspect risk group. So with that, then the doctors, when you suspect case, will assess you. The assessment generally, besides taking thorough history from you and examining you, might also encompass blood tests, because sometimes blood tests might show us some clues of viral infection. In particular, sometimes one of the white cells, which is one of the components of the blood count that we do, may be depressed. We also might do a chest radiograph or a chest x-ray, and that might show signs compatible with pneumonia. And then the definitive test would be looking at whether we can identify the virus, and usually we take what we call a respiratory specimen to test for that. That is done by what we call molecular tests, and usually it comprises of a swab that we take either from the nostril or what we call the nasopharynx, which is the term which is a deeper nasal swab, or a throat swab, and we try to identify the virus through molecular means. So if we identify the virus, then that becomes a confirmed case. Yeah.
Now, doctor, on that note, what treatment is being given to those infected? What are their daily routines like?
Right. So most of the patients actually recover without specific treatment, supportive care. Most of them who have symptoms which are quite similar to the cold. They do not need any specific treatment. In Singapore, we are admitting these patients generally to observe them and to make sure that they are well isolated, that they recover well and they don't deteriorate. So encouragingly, most of the patients do not need specific treatment. Some of them need supportive care. So some of them, when their pneumonia is a bit more severe, they might need some supplemental oxygen, which we can deliver through a variety of devices. For example, nasal prongs, or of course those who are more ill then might need to go to the ICU. In terms of specific antiviral treatments, there are many clinical trials and studies going on around the world. There is no proven treatment yet for COVID-19.
Yep.
Some of the, however, from our experience with SARS and MERS, we know that some antivirals have had some activity, whether it's in experimental models or animal experiments, and even some human experience. So in Singapore, for example, for some of our patients with more severe disease, we have used antivirals, and a common one that we have used, more common, is a drug that we use to treat HIV infection, and that drug is called Kaletra, or lopinavir ritonavir.
Right.
That's the chemical name. And then another drug that we use, that we have been using for more severe cases includes an injectable drug called interferon. But this has been the minority of patients, and we generally reserve it for those who are in a more serious condition or in our ICU patients. Yeah.
Now, Dr. Vasu, let's talk a bit about the unsung heroes, of course, the medical staff at NCID.
Right.
How are they coping, in terms of manpower and everything?
Okay, so I think we are hanging in there, and I would say most people are pretty upbeat. I think, at least speaking from the healthcare worker standpoint, on behalf of the nurses and doctors at NCID and also at Tan Tock Seng Hospital, all of us have been putting in extra effort. I think it's not just NCID, Tan Tock Seng, but actually healthcare workers across the island, and I think it's important to acknowledge that. Of course, at NCID and at Tan Tock Seng Hospital, where all the patients are admitted to NCID, we have seen the bulk of the nation's cases. I think you just mentioned we had 90 cases, so most of them have been admitted to us. They are keeping upbeat. We have received a lot of encouragement, care, well wishes, notes. People have been feeding us, and that's brought us a lot of encouragement. Cab drivers are not avoiding Tan Tock Seng Hospital nor NCID. In fact, I took a cab yesterday to work, and I asked the cab driver whether he had any qualms about coming to the hospital, and he said no, and it was pretty encouraging to me. So all around we've had pretty good support, and NCID was really our motto is strong, trusted, and united in keeping Singapore safe from infectious diseases. So we were formed for that purpose, and right now in this crisis, we are glad that we can play a role. Yeah.
Now, Doctor, the outbreak has been ongoing for some time now. Is there anything new about COVID-19 that you could share with us that we didn't know of yesterday? Like in terms of traits or characteristics.
Okay, so in terms of COVID-19, I think a lot of information is coming out of China, where we have seen the majority of cases. What we know about the virus now is that the incubation period, which is from when you are exposed to when you develop symptoms, the average is really about 3 to 7 days. There have been some reports which has caused some concern, and in recent days, some people have talked about asymptomatic transmission and whether you can get infected from someone who's not displaying symptoms. But I think it's important to note when we look at these reports that some of them have not had a very accurate history when the reports were made, and sometimes in outbreak areas where we cannot rule out contact between multiple people, or maybe a second exposures or transmission from the environment. It's quite hard to say from the 1 or 2 reports which have come out whether transmission really occurs from asymptomatic or people who have no symptoms. What we do know is that because this disease has a wide range of symptoms, some people have minimal symptoms, that we know. But we think that most cases of infection and human-to-human spread arise from people who are displaying symptoms, who are coughing, who are spreading infectious droplets, and that's where most of the transmission occurs. I think it still remains to be seen how much and whether asymptomatic transmission plays a major role, if at all. Yeah. So I think people need to bear that in mind, and I think while reports come out, they're always, because this illness is there is a biologic phenomenon, so sometimes outliers are not unexpected, but we really need to concentrate what is the main means of transmission, what we best know about the disease. And I think as more data comes out from across the world, we would welcome that. Yeah.
Now, Doctor, for those who are discharged, how long are they monitored for? Are they still on a watch list?
Right, so when they are discharged, as far as we know, and also in speaking to our colleagues from China, reinfection with the virus has not been well described or reported. In fact, most of our colleagues in China, in our own experience, we don't think that reinfection is a prominent thing, or that it actually, there's no documented proof that it occurs. So we know that in coronavirus infections, when people are infected, they do develop antibodies, which we believe are protective. When people are discharged from the hospital, they go through a regimen where we do check their respiratory secretions and make sure they're negative twice, 24 hours apart, and their fever has resolved and their symptoms have improved, and then we discharge them. At that point, we also give them a follow-up with us to our clinic to make sure they are well, and when they are discharged, they actually go back healthy and they go back to their families. And I think a lot of them do want to be reunited with their families whom they have not seen for a while. Yeah.
Right. Now, Doctor, just on a final note, it appears that only those who are old and suffering from other ailments, have died from this virus. How accurate is this?
Right. I think from the Chinese data, the Chinese released a study of over 70,000 of their patients, and from their data, yes, it supports the finding and that older patients and patients with other what we call medical conditions are at higher risk of dying from this disease. However, having said that, coronavirus infections can sometimes affect younger people, and as you know, in China, there have been several healthcare workers who have been younger who who have been exposed to the virus and actually have succumbed to the disease, and they were not exactly in the older age group. So we do treat this virus with respect. While most people who succumb to disease are in the older age group, it is a virus which is new. And like SARS, it has affected people of all age groups, including people who are slightly younger. So it is something that we need to watch out for. But however, you're right that it affects the people it generally affects in a more serious way are the older folks. Yeah.
Well, thank you so much, Doctor, for coming in and for taking the time to speak with us.
Okay.
Of course, that was Dr. Sean Vasu, Clinical Director at the National Centre of Infectious Diseases. And those were the top stories of the day. Keep up to date with news in Singapore and around the world at straitstimes.com. I'm Dylan Ang. See you tomorrow for more stories on The Big Story.